Hi, everyone. My name is Dr. Kristen Brewer, and I am an assistant professor at Simmons University. My background is in sexual and reproductive health education. I'm also one of the founders of Ruth's Army, which is a grassroots organization here in Clarksville, Tennessee, that is focused on providing education, outreach, and access to those in this area for sexual and reproductive health education, and different aspects of like access to abortion care, information about that, as well as we've done some like workshops and panels and stuff like that. So just kind of a little bit about what Ruth's Army does. And then we also have.
Hello, I am Dr. Tracy Coffey. I am an OBGYN here in Clarksville, also one of the co-founders of Ruth's Army. And today we're excited to tell you about the REACH Clinic, which is a coordinated effort amongst different groups in Clarksville and the surrounding areas to provide improved access to care for sexual and reproductive health education and contraceptive health.
All right, well, let's jump into it. Let's see if I can make this work. Yay. All right. Be great if the whole slide popped up.
Yeah.
Okay, so a little bit about the background of the landscape in Tennessee, which I'm sure you all probably somewhat familiar with, but just wanted to make sure we covered some specific aspects that are really important to why there's a need for us to do this kind of work. One, the education in our state, sexual health education is not required from any school system until the teen pregnancy rate is already a problem, till it's over 19 per 1,000 births in Tennessee. So we wait until there is a problem with teen pregnancy, and then schools are only allowed to teach abstinence-centered education. So we wait till there's a ton of pregnant teenagers, and then we tell them not to have sex. So that's not a very effective way of educating our youth on how to keep themselves safe and to make informed choices when they do find themselves in the position of engaging in sexual behavior. In addition, it's really hard for our teachers to develop a curriculum that's aligned with the state legislation. The politicians put some very specific language in place on what is allowed to be taught in a sexual education curriculum, and they're not teachers. So you have teachers that are trying to develop a good curriculum, a cohesive curriculum with very restrictive policies. So it's very difficult for them to do that.
In addition to most of the legislators not being teachers, most of them are also not physicians. And in August of 2022, the Human Life Protection Act, or otherwise known as the trigger ban in Tennessee, went into effect, which effectively banned all abortion care in the state, making it a Class C felony, not for the patients who were receiving the care, but for the physicians who were providing that care. And that was in all cases of termination of pregnancy, whether it was an ectopic or a molar pregnancy, or abortion for any reason. In April of 2023, there were some amendments made to the initial law that allowed for taking care of, again, ectopic pregnancies, which are very likely to kill a mother, and a molar pregnancy, which is very likely to lead to gestational trophoblastic disease or certain types of cancers. So those two exceptions are now in place, but otherwise all abortion care in the state of Tennessee is still effectively banned. There are no other exceptions for life of the mother or for cases of rape or incest. And there are a number of bills that are being proposed that would specifically target those who are helping minors to access abortion care in the state. So it's still one of the most restrictive laws in the country, and it disproportionately affects certain populations in our state, which we're going to go over in the next slide. So nearly half of the pregnancies in the United States are unintended, and these unintended pregnancies have been linked to negative outcomes for both the pregnant person and the infant. Rural women are more prone to poorer health outcomes, and namely as a result of having less access to healthcare than their urban counterparts. And in Clarksville, we are considered an urban area, and we're not technically a maternal health care desert. However, all the surrounding counties in Tennessee and in Kentucky are maternity health care deserts. So Clarksville is a little bit unique in that it is the fifth largest city in Tennessee, but we have a significant patient population outside of our actual city that is receiving care from the physicians that are here in Clarksville. Additionally, we have gone in the 12 years rather, that I've been here, from having 14 full-time OBGYNs to now having 7. And while we are trying to recruit additional physicians to the area, going back to the trigger ban that's in place, it makes it very difficult to recruit quality physicians to an area where they might be guilty of a Class C felony by providing appropriate and medically sound care. When we're looking at the rest of the impacts on the sexual and reproductive health outcome, people of color and those that are living below the federal poverty level are more likely to experience poor maternal outcomes, up to 3 to 5 times, Black women are up to 3 to 5 times more likely to die in childbirth as compared to white women. And that's independent of socioeconomic status, education status, all other factors. Black and African American people make up about 12% of the of the population of the United States, but they account for about 40% of people living with HIV. And that's important for what Reach Clinic is trying to accomplish with regards to HIV resources in Clarksville. And Black women are disproportionately affected by HIV, with rates of new HIV infections being 10 times that of white women and 4 times that of Latina women.
So what we have done to try and address those issues, because we see that played out, we see the statistics nationally, and we know that this is an overwhelming problem nationally, but what can we do here in our community to help those who need it? So I talked a little bit about Ruth's Army at the beginning. That's Tracy and I and a couple other women in the area founded this organization, and we were trying to find ways to help educate and provide outreach to people in the area, Clarksville and those surrounding counties, to get them education and access that they may not otherwise have, or is available in Nashville, but not everyone loves going into downtown Nashville. So wanted to bring those services here to our community. And then Tracy thankfully has this amazing practice and had an amazing opportunity to talk about that for us to partner with
Yes.
Ruth's Army.
Yes. So our practice is Queen City Women's Health in Clarksville. My partners and I are very like-minded and are very driven to make sure that we're improving healthcare equity in Clarksville. We were finding that we had a supply of what's considered abandoned LARCs or IUDs, Nexplanons, other contraceptive devices, where a patient had ordered those devices and then changed their mind about having it placed for one reason or another. Those devices were not able to be sent back to the pharmacy. Insurances were fine with us keeping them, but obviously we wouldn't use them for a different patient. So we found that they were actually just being stored, and some of them were actually expiring before they could be utilized. So we have these abandoned devices, and we know that we have a patient population that is underinsured or uninsured that would love to have access to those contraceptive options. And so that's where the Reach Clinic was born from, which stands for Reproductive Equity and Contraceptive Health. One of the other things that we do want to focus on is not necessarily the providing a placement of contraceptive devices, but also the removal. We want to make sure, again, in the line of reproductive equity, that any person who wanted to either receive contraceptive options from the clinic or have an IUD or a Nexplanon removed also had that same availability. And that's one of the things that the Reach Clinic is providing.
Yeah, so
Music City Prep, sorry.
Yeah.
Music City Prep, yeah. Yeah, my bad. Is also partnering with us to provide STI and HIV testing to people in the Clarksville, Montgomery County area at no charge. They also provide PEP and PrEP information and medications for those who are interested. And then Ruth's Army is also providing safer sex products, and condoms are available. We are working to try and provide other contraceptive options like birth control pills, the ring, the patch, so that people have a wide array of contraceptive options available through Ruth's Army and Reach.
And it's not on here, but Plan B too. Ruth's
Oh,
Army
yeah,
does
sorry, yeah.
keep, yeah. Ruth's Army does
Yeah.
keep Plan B available too for those who need it. So kind of continuing on with what Reach does, our purpose was to we really wanted to address barriers to education and access. So the lack of comprehensive sexual and reproductive health education in schools, people who don't have insurance or who may have insurance but are underinsured, because even if you have insurance, it may not cover, an IUD or things like that. Costs in general can be prohibitive. Like even if you do have insurance, if an IUD is the best option for you, it can still be very expensive. Or if you don't have, the disposable income for any type of contraceptives, even if it is covered, or if you have a hormonal option, but you also want some barrier options, and there are costs for those. So we're trying to address that barrier as well, so that everyone has access. Transportation, the location is right off the bus route too, so you don't have to worry about having like a working vehicle. We also aren't requiring appointments, because that can be an issue. We all have things that come up at the last minute, and there's that fear of, oh, if I cancel, but am I going to be charged, or am I taking a spot from someone else? Or, my childcare is late, so I got to push back my time. That's totally fine. We do not require appointments at all. Essentially, we run from 9 to 2, and you show up when you can, and we will get you the education and the one-on-one time with a provider that day to kind of discuss any questions that you have, the best course of action for you and what works best with your lifestyle and what you have going on. And again, like Dr. Coffey said, that focus on reproductive justice, because we know that these barriers impact many people, but historically, we also know that they disproportionately impact marginalized groups, those of low socioeconomic status, adolescents, unhoused, Black, Indigenous people of color, intimate partner violence survivors. They face more and more of these barriers when you look at that intersectionality too. So wanted to make sure that as many barriers as we have control over, we are going to completely address for anyone who needs those services. And then we're going to share the full education slides, those of you who are interested in, but as part of the Reach Clinic, Ruth's Army delivers some education on sexual and reproductive health. And we're calling it what they didn't teach in school, because it's not comprehensive. But just kind of an overview, these are the topics that we cover. We go over the different types of contraceptive methods. We also discuss the importance of regular screenings to include mammograms and pap smears. Oftentimes, women who don't have access to regular, those preventative doctor's visits are missing the nudge from the providers to, hey, it's about time for you to start getting your mammograms, or it's time for your pap smear, and doing these screenings, which help to detect early these issues. And the earlier we can detect these issues, the better they can be treated and the better your health outcomes. So that's really important to us, to be able to educate women on when they should start, talking to a provider about mammograms, or how often they need to get pap smears. Also, we do a brief overview of advocacy and how to advocate for yourself when talking to a provider, because there's also that historic, authoritarian barrier there between patient and provider oftentimes. So how to talk speak up for yourself and ask questions. We talk about the importance of self-breast exams as well, because not everyone has access to mammograms, but self-breast exams can be a really useful tool for early detection. We cover a couple early signs and symptoms of other issues that you may think are common or may be typical for you, but could be indicative of another issue. And then we cover some HIV education and ways to protect yourself, because again, women are the fastest growing group of new cases, specifically Black women. So want to make sure that everyone knows how to protect themselves. These are the different types of contraceptives that we cover, as well as how effective they are. And I always like to point out the withdrawal method, the pull out and pray method, is about 73% effective. So worst case scenario, if that's the position you find yourself in, it is better to pull out than not to pull out. So that is my personal flag that I'm trying to tell people. And then this is an example of some of the infographics that we use to kind of help the people that come into the REACH clinic learn how to do these self-breast exams. And we're in the process of getting a lot of our information translated into different languages that are often used in Clarksville, Montgomery County area. And then we'll have these, there's a QR code on the slides that they can scan that takes them to this, but our hope is to also get some printed. And then plans for the future. We're hoping to expand our services to provide some of those other early detection screening methods that we'd really like, women in the area to have access to, like mammograms, pap smears, HPV vaccination, and then, like I just mentioned, expanding the language options. But, and again, to reiterate, we're trying to do this all through the reproductive justice lens. And we're using the sister song definition of the right to maintain personal bodily autonomy, to have children, to not have children, and to parent the children that you have in a safe and sustainable community. So our hope is that we're providing education and access to those who really need it in the area. And then if I can move my mouse over.
Yeah.
There we go.
Well, and after we have that education component to the REACH clinic, after patients or people have had the opportunity to ask questions, if they have any, they can either go through Music City Prep to do STI and HIV screening and education, or talk to a provider one-on-one about their contraceptive health, or both. And when we have that one-on-one time, we wanted to kind of briefly go over how patients can learn to be their best advocate when it comes to having that discussion with a healthcare provider. So some tips for good communication with your healthcare provider, coming prepared to an appointment. And as a physician, I actually really appreciate it when patients come in with a list. Kristen and I were just talking about that, and it sometimes feels from the patient's perspective that maybe they're asking too much or they're being too demanding. But in all honesty, when patients come in with a list of their questions, and that helps us keep the appointment focused on the things that the patient finds most important. We all have our own agendas when we come to an appointment like that. And if we're able to communicate well about what is important to you, then that's going to make sure that this appointment is actually tailored to what you need. Being honest with your doctor, especially with sexual and reproductive health, it's common to be nervous when talking about very personal or private matters. But part of my job is to help you know that you can share these concerns no matter what they are. I can't help if I don't know what's going on and if I don't know what's important to you. So I don't want to assume I know what your goals are for seeking treatment. It's important that you're able to communicate that with me so that we make sure, again, that we're taking care of the things that are most important to you. In addition to things that may be a little embarrassing to talk about, please remember that sharing information about behaviors that may be more risky or illegal in some cases, like drug use or involvement with high-risk sexual behaviors, will also allow us to take proper care. I would change my counseling depending on some of those activities. So it is really important to be able to have that open discussion so that as a physician, I know who you are and what activities you're involved in and what things are important to you. Because without that clear communication, again, my advice and tailoring of management and treatment options are not going to be addressing the things that are most important to you. And then discussing barriers to care that you might have. Again, are there financial limitations to treatment options? You know, we might go over some available resources and treatment paths, but if there's a big financial restraint that doesn't, if you're underinsured or uninsured, you know, we're definitely going to be tailoring it to what is going to be the most affordable option. And other things to consider: do you have good support at home? If the support that you have is limited, or your transportation issues are there, how can we best deliver the care in a way that will be beneficial for you? And part of providing the good care is knowing how to best provide it for an individual, and discussing those barriers helps us understand that for you. And then the last part is to not be afraid to ask questions, or to let your provider know that you didn't understand something that we talk about. It's sometimes hard to do that. I understand, you know, Kristen kind of touched on that authoritative feel for most doctor's appointments, you know, and sometimes people are a little nervous about speaking up, but it's sometimes hard to do that, and having some available phrases to use might be helpful. Like, can you help me can you help me understand more about blank? Or I need to talk with you about something, but I feel like I can't. Can we talk about this specific part of my health? Or again, in talking about options for care, asking, are there any other options? Would you recommend getting a second opinion? Those things aren't insulting to me as a physician. I think that, you know, in order to really make the best choice for you, you have to understand what your available options are and if there are any other alternatives. So, you know, be comfortable speaking up, be comfortable saying no, be comfortable letting me know that that doesn't seem like a good option for you and why. Help me address your concerns in a way that respects your autonomy. So we want to make sure that people understand that, like, the good communication, like in any relationship, your relationship with your medical provider, that's going to be key. Our
All right.
contact information, yeah. If anybody has any further questions or any follow-up questions or concerns, please do let us know.
Great.
Yeah, thank you for this opportunity.
Yeah, thank you.